The current smoking problems in Malaysia. The tobacco epidemic is one of the biggest public health concerns that the world has ever faced. According to World Health Organization, tobacco kills more than 8 million people each year. More than 7 million of those deaths are due to smoking, while around 1.2 million are the result of non-smokers being exposed to secondhand smoke. In the year 2020, 27,199 tobacco deaths were recorded in Malaysia, and as much as 15,785 million Malaysian ringgits were involved in tobacco-related costs to the economy. In the year 2016, approximately 9.42 billion cigarettes were produced by tobacco companies in Malaysia. However, the even shocking truth is the number of cigarette imports was way more than the cigarette exported to other countries. Based on the National Health and Morbidity Survey held in 2019, 21% of Malaysians are cigarette users, while 5% of the population are e-cigarette users. Have you ever heard of e-cigarettes? An e-cigarette is a battery-operated device that allows smokers to inhale nicotine through a vapor. It can sometimes be referred to as electronic nicotine delivery system, ENDS. Unlike traditional cigarettes, the devices do not contain tobacco. As e-cigarettes are gaining popularity among smokers, the device is evolving into a smaller, fancier, and more convenient gadget. Preference of e-cigarettes by youths in Malaysia. A study has been done to investigate the use of e-cigarettes among university students in Malaysia. Out of the 1,302 smokers from 6 different universities, 74.9% of them smoked e-cigarettes, where 40.3% are dual users who smoke both tobacco cigarettes and e-cigarettes, while 34.5% are exclusive e-cigarette users. Also, the majority of e-cigarette users are male. But the question is, why e-cigarettes are becoming so popular in our country? Studies showed that young adults prefer e-cigarettes because they come in various flavors with good taste and smell. Besides, youngsters tend to try smoking e-cigarettes out of curiosity and engage in smoking habits ultimately. Similarly, certain people think that smoking e-cigarettes may help them to become an insider and gain popularity when they see people around them smoking. With the advantages of cheap prices and easy accessibility, there are more distributors of e-cigarettes appearing in Malaysia. Ironically, e-cigarettes are used by smokers as a smoking cessation tool to help them quit smoking. They also perceive that smoking e-cigarettes are less harmful to the health when compared to conventional tobacco cigarettes. Unfortunately, there are currently no strict regulatory laws being imposed on the usage or selling of e-cigarettes in Malaysia. Thus, smokers opt for it to smoke in public open spaces. However, do you know e-cigarettes are actually more harmful than regular cigarettes? There are some e-cigarette brands that claim to be nicotine-free but have been found to contain nicotine. E-cigarettes have fast and high concentrations of nicotine delivery to the brain, increasing addiction risks. It is just different products but the same danger. In 2019 it became clear that e-cigarettes could cause seizures and serious lung damage after just a year, possibly less, based on CDC reports of patients hospitalized for lung damage caused by e-cigarettes. Also, there is no study proven that e-cigarette smokers are likely to successfully kick smoking habits. What is in the aerosol of e-cigarettes? In the aerosol, we found that it contains volatile organic compounds, VOX, flavoring chemicals and formaldehyde. At certain levels, VOX can cause eye, nose and throat irritation, headaches and nausea, and can damage the liver, kidney and nervous system. Some flavorings are more toxic than others. Studies have shown that some flavors contain different levels of a chemical called diacetyl that has been linked to a serious lung disease called bronchiolitis obliterans. Formaldehyde is a substance found in building materials and embalming fluids, was present at 10x than carcinogens found in the smoke from regular cigarettes. Therefore, the aerosol of e-cigarettes is very harmful. But, how to combat e-cigarettes issue? First, set the legal age of buying and smoking e-cigarettes at 21, which reduces the chance of e-cigarette smoking among high school youths. The licensing, production, distribution including import, export and sale of e-cigarettes devices, nicotine-free liquid and vapes will be regulated. Also, a harsher penalty will be given for those who breach the law. E-cigarettes and vapes prohibited at all, no smoking areas, while shisha will only be allowed at certain permitted places. Promotion, advertisement and sponsorship of tobacco products will be banned. Displaying tobacco products behind counters are banned. The legal sources of tobacco in Malaysia. The implementation of high tax in cigarettes is the main cause of consumers to change from legal cigarettes to illegal cigarettes. The current price of legal cigarettes cost between RM 15.50 to RM 18.00. The average smoker can easily spend more than Rm100 a week to get that euphoric addiction of nicotine. Because of the high upkeeps, it is not surprising that most smokers in Malaysia are turning to cheap, illegally smuggled cigarettes to fulfill their cravings. According to the Consumer Choice Center, CCC, over 60% of Malaysian 5 million smokers are consuming illegal cigarettes. According to the Illegal Tobacco Trade 2021 Malaysia report, Malaysian authorities seized a total of 40 million sticks of illegal cigarettes in 2020, whereas a total of 84 million sticks were seized from anti-smuggling operations in coastal areas in the first quarter of 2021 alone. This proves that tobacco black market is flourishing more than ever in Malaysia. What is illegal trade? Simply put, the illegal cigarettes trade in Malaysia is largely the supply, distribution and sale of smuggled cigarettes, also known as contraband cigarettes, which are smuggled into the country from neighboring countries without the payment of required taxes and duties. These cigarettes are not at all regulated and do not comply with any laws imposed by the government, which include no mandated labeling requirements such as graphic health warnings, as prescribed by the Ministry of Health. Why does it occur? A key factor that contributes to the economic incentive to trade in illegal cigarettes is the high prices of legal cigarettes in Malaysia, led by excise duties imposed over the years. Illegal cigarettes, on the other hand, are sold extremely cheap, from 3 to 5 ringgit Malaysia, and are easy to purchase. The high demand for cheap illegal cigarettes serves as a major incentive for smugglers and retailers to engage in the illegal cigarette trade, as the huge economic opportunity it offers far outweighs the risks involved. As a result, criminal activity is thriving across the country, costing thousands of jobs in manufacturing and retail, and a huge loss in tax revenue. So, how do we identify an illegal cigarette pack? An illegal cigarette pack can be identified as having at least one of the following features. Absence of registered importers. Unregistered importers. All brands sold in Malaysia must be registered with the Royal Malaysian Customs. Absence of registered manufacturers. Unregistered manufacturers. No or wrong description of registered importer or manufacturer. All manufacturers must be registered with the Royal Malaysian Customs. Packs with counterfeit, fake, Malaysian tax stamp. Packs without Malaysian tax stamp. Blue tax stamp, domestic market. Pink tax stamp, duty-free market. Packs with non-Malaysian tax stamp, unregistered brand, non-compliance to Ministry of Health's Control of Tobacco Product Regulations 2004, absence or non-compliance of pictorial health warning requirements. Absence of 12 pictorial health warnings is listed by the Ministry of Health. Pack size other than 20 sticks, absence or non-compliance of mandated labeling requirements. The following data is the illegal cigarettes incidence at national level. As in October 2021, the incident rate is 57.3%, which is slightly lower than in September. The table below shows that the most common illegal cigarettes brands, and those 10 brands listed, account for around 77% of illegal cigarettes volume. 85% of illegal cigarettes are without tax stamps, while remaining 15% are with fake tax stamps. Sabah has the most incident rate of illegal cigarettes, followed by Terengganu and Sarawak. Smoking-associated disease and deaths. The top first main cause of death in Malaysia is ischemic heart disease. It accounts for 17% out of the total deaths in Malaysia. Although a year has passed, ischemic heart disease still remains as the principal cause of death in Malaysia, with 17.0% of the 109,155 medically certified deaths in 2020. Cigarette smoking is found to be one of the major factors leading to the development of ischemic heart disease. Therefore, the issue should be further clarified to understand the problem it causes to the country. Prevalence of ischemic heart disease due to smoking. First of all, the risk of myocardial infarction is increasing from 1 to 3-fold among current smokers. Hypertension prevalence among smokers is also higher than non-smokers. Other than that, the death age distribution due to ischemic heart disease in Malaysia appears to be similar to that in Western societies, where the mortality increases with age. Additionally, there is higher incidence of males suffered from coronary heart disease compared to females, according to the statistics of coronary heart disease in Malaysia. So, how does this become a problem towards the individual in our country? Firstly, decreased quality of life for the people diagnosed with coronary heart disease. Quality of life is defined as the ability to do physical and social activities. Patients perceived that physical symptoms such as shortness of breath and chest pain had a negative impact on their quality of life. This will subsequently limit their ability to perform daily activities. Therefore, this proves that the coronary heart disease problem associated with smoking is an issue to be emphasized in our country. Where do we go when we are sick? It is definitely the healthcare center. However, we need to remember that the healthcare needs to cater to various kinds of diseases, hence, too many cases of certain diseases may collapse the healthcare system. This goes the same as the higher cases of coronary heart disease. Higher costs are required to treat the diseases and they are not cheap. Lastly is the higher fatality rate. The increase of the number of deaths due to ischemic heart disease which associated with smoking is alarming. Increasing pattern of death each year results in a higher fatality rate. This will impose a macroeconomic burden that is inequitably distributed and thus, leading to increased project gross domestic product, GDP, loss. How does smoking cause heart problem? Smoking harms nearly every organ in the body, including the heart, blood vessels and lungs. The chemicals in tobacco smoke harm your blood cells. They also can damage the function of your heart and the structure and function of your blood vessels. When combined with other risk factors such as obesity, overweight, diabetes, pregnancy, woman on birth pill, unhealthy blood cholesterol levels and high blood pressure, smoking further raises the risk of heart disease. These will worsen the conditions such as instant and long-term rise in blood pressure and heart rate, blood clot formation and double the risk for stroke. The more you smoke, the higher risk of getting cardiac disease, factor leading to heart disease. Atherosclerosis, when plaque builds up in the arteries. Over time, plaque hardens and narrows your arteries. This limits the flow of oxygen-rich blood to your organs and other parts of your body. Heart disease also can result from exposure to secondhand smoke that comes from cigarettes or smoke that breathed out from smoking people. Secondhand smoke causes nearly 34,000 premature deaths from heart disease. Non-smokers who are exposed to secondhand smoke at home or at work increase their risk of developing heart disease by 25 to 30% and the risk for stroke by 20 to 30%. However, we can control the problem. Personal initiative include joining a smoking cessation program and avoiding going to smoking places, while stakeholders like the media, sports industry, and cultural activity planners need to ban tobacco ads. As a community, creating a smoking-free area can greatly reduce secondhand smoker risk. The best way to safeguard your heart from smoking-related disease and death is to never start using cigarettes. But if you do smoke cigarettes, the earlier you can quit, the better. Quitting smoking will reduce your risk of developing and dying from heart disease. Over time, quitting also will lower your risk of atherosclerosis and blood clots. If you smoke and already have heart disease, quitting smoking will reduce your risk of sudden cardiac death, a second heart attack, and death from other chronic diseases. We should concern the arising issue of e-cigarettes, illegal tobacco sources and diseases due to smoking habit because they slowly killing us and devastating our health. The best way to overcome this is by quitting smoking. Thank you for watching.